Okay, let's now review the points on the extraordinary vessel. So anybody can answer this. And I'm sure some of you would find this very easy. Okay, number one, which pair of points is used to treat the entire Renmai pathway? So this is actually a favorite point of mine, especially when the patient comes in with abdominal pain. No, tapos may issues siya sa front side. Okay? Answer.
Oh, number
First.
one,
Yeah.
long
First.
7.
Lung 7 and kidney 6. So I think you know the rules, no? Pag babae daw, lung 7 sa right, kidney 6 sa left. Lalaki, okay, lung 7 sa left, kidney 6 sa right. Okay. Number two, in the Guide to Acupuncture Channels, written in 1295, which technique is first introduced for using paired points?
Kaya that are doing it. Aray, oh,
Yes,
kaya mo yan, no? Ay, ito na yung
unilateral
kunin mo.
cross
Okay,
Yeah.
over the
Africa? Didi? Ano?
Ma'am Elvira. Okay, sige. Okay. Ano answer nyo?
number one.
Yeah, host,
Host guest
guest.
unilateral
So
cross
you should know
over.
sino yung host. Unahin mo muna si host tapos si
Yung
guest.
host. Ako yung guest.
Unilateral siya, okay? Okay, this is for Ma'am Joy. So ngayon magpapansinin na niya to. Why are the Do and Renmai sometimes counted as 14 main channels instead of 12? Or why is it part of the 14? Bakit siya napasali sa 12? So, syempre, pagkasama si Du and Ren, 14 na sila, di ba? While the other extraordinary vessels, wala.
Wala ako. Sorry. Sorry.
Ay,
Number one.
yeah.
Number
May
one.
tumatawag sa akin na wala ako sa call.
Sige, mamaya ikaw yung susunod. Okay, number one. Yeah, thank you, Sister Rosa, Doc Rosa.
You're
Because they
welcome.
possess both main channel and extraordinary vessel qualities. Yeah. Which extraordinary vessel's opening points coincide with its starting points? So that means the opening point, yun din yung starting point nila. So this will allow single point treatment.
Yin Chow
Yin
Mai.
Xiao. Yin Xiao Mai.
Yeah, yin chow mai. Okay. What anatomical concept does up and down refer to? Up and down.
Needle
Ako number one.
insertion at 2 successive pulse position.
Okay.
Using one point.
Number
Two successive pulse. Which classic, so we're referring to a book here, no? Explicitly pairs spleen 4 with P6 for Chung Mai. Actually, this is my favorite for women who have menstrual issues at the same time very irritable. Tapos meron din silang GERD. I try nyo po. Very effective. But the question here is, where did this recommendation come from first?
gathering from eminent
Okay,
acupuncture.
Google.
Eminent acupuncture.
Gathering some eminent acupuncturists. Number 7, in the host. Okay, this one you have to know. Okay, host.
Dr. Hector, excuse me. May I know the question 6? What the back of the number? What's that? Like for example, grade how the number 1601. What's that?
That's the year it was published. Sister.
Sorry. Okay, I don't know. That's the book
It's
and
okay.
the
Yeah, the
year
book.
published.
Yeah,
Thank you.
you're welcome.
Sorry,
Number
disturb you.
7. It's okay, no problem. You, don't feel free to ask anything. This is a review class, not a lecture. Okay. Yeah. Thank you for your. You can ask again, Sister Rosa. Number 7. In the host guest technique, what is the recommended order of needling? Uy.
Opening point
Yeah.
first, then
Opening
couple,
Then
couple
couple.
open.
Okay.
Oh, kasi host guest.
Oo naman. Obvious naman,
Opening.
diba, opening. So, host muna,
and
papasok
then
si
get
host. Oo, tapos si guest. Okay. Which pair of points is described as they respond to each other in the great treatise of acupuncture? Ay, wow, responding to each other. Ay, actually, favorite ko rin to. Mm. Answer.
number
Number
one.
1.
Yeah, number one. You know what? This is so effective for back pain. Tapos are also complaining of like practically the whole back. Ay, wow, nag-ano siya. Bakit wala siyang name? Okay.
Tapos spine.
SI3 and bladder 62. Yeah. The pulse quality, which is firm. Okay. All three left, puro left because chi ang inaano natin ha. Okay. Diba chi? Left is chi, isn't it, Sister Rosa? Okay. Okay. If the pulse quality of all the three is firm, this indicates pathology in which vessel?
Chong.
Chongmai, yes.
Oh.
Try this on, yeah, I've seen this. Okay. So okay, basta Chongmai. Which vessel's area includes both the lower abdomen or genitals and the mouth gum? So front na front. What's your answer?
Ren.
Ranmai.
Okay.
Which of the following is not a recommended use of the opening point alone? So that means it will not work if you only use the opening point.
Mm,
Treating,
treating Chong. Mai.
Chiang Mai.
yeah. So, paano nga ang Chiang Mai? What are the
Mm,
points? Spleen 4,
spleen for Ren 1.
6. Okay.
Yeah.
In the sex-specific protocol, which point is needled on the right side of a female patient ay, when opening the ranmai? Okay.
Wait, ano? Saan na tayo?
Ano yung nininidal nyo sa right side ng female?
Kidney
Yung lang
6.
sa...
Uy,
Kidney
Yung baliktad. Ay,
baliktad.
parang
I think it's lung,
Lung
lung
7.
7. Lung 7.
lang 7.
Lung 7.
Right.
Yeah. Lung 7. Medyo na-confuse ang nagtanong nito. Akala kasi lalaki.
No, kasi
Sabi daw nila,
opening.
the female is always right, which I beg to
Always right.
disagree. Okay, so
And since the opening is lang
right,
7.
lung
So
7,
lang
kidney
7.
6. Kasi Renmai ito. Which classic does not give specific instruction to use the yin and yang Weimai points on their own?
Great Compodium of Acu.
Compendium.
Wow, okay, alam niya.
Compendium. Compendium.
Number 14, the main channels are compared to rivers and extraordinary vessels are compared to what?
Reservoirs.
Yeah, reservoirs. So parang pag sumobra, dito na pupunta. Is it correct? Yeah.
Yes.
So the rivers, diba, the rivers should always flow, diba? Which pair of points is used to treat symptoms of both earache and lateral lower leg pain via the Yang Wei Mai? So remember, Yang Wei Mai is yang linking vessel. That means it links all the yang. So we will be thinking of the opening and the
Kasi alam ko yung GB41 kasama. So, ibig sabihin number 1.
Number 1.
yes, of course, number 1.
Alam ko yung earache, it's GB41.
GB5 and GB41. So this is very important, especially if sabay may earache siya, or if he comes to you complaining of lateral lower leg pain, so yang na yang, tanungin mo bigla, may earache ka rin. Okay. Minsan Makate yung teka. The Great Treatise of Acupuncture pairs which point with Hushi, that's SI3. Ay, Sorry. Kidney 3. I'm not sure.
Which
Yata
one?
sushi. Yeah, Taishi pala ang kidney 3. Hoshi is SI3. So
SI3.
the
Yeah.
partner
That's
is,
I3.
So the partner is bladder 62.
yes, yeah, everyone agrees. Doc
Yes.
Rosa, yeah.
Yes.
Which extraordinary vessel is said to meander most evidently through multiple main channels? So, naglalamierda parate.
Nagtatanong.
Gagara.
Ay, ano yun? Okay.
Yang Chow.
Yang Chow.
Yang
Yang Chow Man.
Chamai, think of the eyes. Okay. Which of the following pulse patterns would suggest excess yang in the head via the yang chow mai? Okay. So, sumasakit ulo
The
nito.
following pulse patterns.
Yang chow mai.
Number 1.
Wiry.
Wiry. Both front positions of right and left. So, actually, this is very true, no? Very common to sa mga medyo bata-bata pa. So, pag masyadong superficial usually, tapos wiry, no? That's, you use yang chow mai. When using the unilateral crossed over technique, which of the following best describes the spatial relationship of the 2 points?
Number 1.
Yeah,
One on arm. The
one
other on.
arm, other opposite. Yeah.
Arm and leg. Opposite.
Okay, let's now go to Yang Wei Mai, Yang linking, no? The opening point is
Number 5.
Number 1.
TB5.
Yang Wei
Alam na
TV.
natin, Yang Wei Mai ha, TB5, GB41. Okay. Which of the following is true about the Tumai? Ay, easy. Usually the longest one is the answer.
Number 1.
Okay. Okay, Tumai, and yeah, this is also true for Ranmai, they have their own points. The gatherings from eminent acupuncturists written in 1529 ends the symptom description of each extraordinary vessel with what instruction?
Number
Yun din ba
1.
yung kanina?
Yeah, needle the opening point first, then the paired.
Then the pairing.
Which vessel's paired points are listed as P6 and kidney 9? P6 and kidney 9.
Yin Wei.
Huh? Walang
Yin Wei.
sumasagot.
Yin Chow.
Okay.
Alam ko
Chow
Yin Wei.
Mai. Which
Ito
of the
Yin.
following best explains why the same pulse quality in multiple positions, okay, indicates extraordinary. So dapat, okay, now we know pag pare-pareho ang quality, especially on the left wrist, no? All three, pare-pareho ang quality. So you'll be thinking of using an extraordinary vessel. So what's the answer here?
Number 1.
Yeah. The vessel acts as a reservoir, absorbing chi from several main channels. So pinupuno niya, so pare-pareho na sila. Which modern text advises using the opening point first and the coupled point second? And by the way, when you withdraw, reverse order yan ha. Unahin mong tanggalin yung coupled point and then last naman yung opening. Is that clear? The question
Kapag natanggal.
Yeah, pagtanggal, opposite. Okay, I think na-answer na ito ni Ma'am.
Number 1.
I know, hindi pala. Modern Chinese textbook. Quoting To Hong Ching. Which pair of points is used to drain the yang chow mai for insomnia?
Bladder 62.
Okay, yeah, bladder 62. So Yang Chow Mai, yeah, bladder 62. Okay. The opening point of which vessel is RAN 1? So siya din yung first point opening vessel. It's
Right. Renmai.
Ramay.
Is Ren.
which of the following is not a possible way to use an extraordinary vessel?
Using only the
only
coupled
one.
point. Because you have to have the opening point. So number 3
Mm-mm.
is not right.
Yeah, using only the couple. Look at ang busy-busy.
Tama ba, Doc?
Yeah, yeah.
Number 3 ba?
Okay. Is it number 3, Sister Rosa?
Yes.
Yeah. Number 29, which historical figure is credited with teaching the sex-specific paired point method in the early 70s?
Number one.
Yeah,
Kasi hindi siya Chinese.
J.D. Fun, of course. The phrase setting a
Done.
very broad net in an open country to catch a single rabbit is used to illustrate what concept? Wow.
So
Number
setting very
one.
broad net. Open country
Number
to catch
1.
us.
Mm,
Ano naman ang phrase na yan?
oo nga. Grabe no.
Setting a very broad
Isip ko
net.
talaga. So ang naisip ko yung net malaki. Parang inano mo na, parang minaximize mo na. Which vessel's opening point is listed as 2-1? Of course,
Dumay.
Dumay.
Tumay. Which vessel is associated with the flooding and overflowing of main channels into its pathway?
The 8 extraordinary.
Of course.
Yeah.
That's why it's called the reservoir, no? Which pair of points is indicated? Actually, if you don't know what to do anymore with the patient, I think kung walang effect, no, you might think of using the extraordinary. Which pair of points is indicated for treating blood stasis in the Chiang Mai? This is very important, especially for
Number 1.
yeah, split 4 and 6.
And pieces.
What is the clinical effect of needling a point on the vessel itself? For example, sa round 4, compared to needling the opening coupled pair?
Number one.
Okay, yeah. Specific lang kasi siya.
Yeah.
It does not affect the whole track of the vessel. Which of the following statements about the host-guest technique is accurate?
Number one.
Yeah, number 1. Kasi
Yeah.
yung number 2, 3, and 4.
Then
hindi.
expanded.
Kahit hindi ko alam yung number 1, yun na lang kasi hindi yung 2, 3, and 4.
Okay. The unilateral crossed over method harmonizes because it has dualities, because of its dualities. Because it harmonizes which dualities?
Number one.
Above,
Of the-
below,
Below,
and left,
and
right.
right.
Which point is identified as Sul and Chi in the tabular list?
Zone and Chi.
GB 41.
41. Which vessel's area includes mouth and gums as part of its influence?
Ren.
Okay, Ranmai. The pulse pattern wiry. Okay, pag wiry on both front positions indicates excess in which vessel?
Yang Chow.
Yang Chow Mai.
Yang Chow.
That means hindi siya hindi maganda yung tulog niya. Which of the following is not an effect of using opening coupled points together? Not
Number two.
Direct.
Directly stimulating the vessel's internal.
internal.
Negative.
Okay. Which 2 points constitute the opening coupled pair for Yang Chow Mai?
Ladder 62.
Number 62
And
and
SI3.
SI3.
The great net, yung rabbit, no? Analogy, was originally used to describe which therapeutic principle?
Number 1.
Number 1.
Opening coupled points.
Yeah, to cover. Wow, ang galing. Which of the following best captures the view on using only the opening point for yin and yang chow mai?
Number 1.
Yeah, because the opening point equals the starting point. What is the primary reason for needling the paired points in reverse order upon withdrawal? This is a nice question.
Number 1. To
Get
complete
sequence.
the whole yes sequence.
Di ba usually last na aalis yung host kasi siya may-ari ng bahay. Which vessels
Tama.
paired
Oo nga,
points
no?
oh, grabe, no? Which vessels paired points include TB5 as the opening point?
Yang Wei.
Yang Wei Mai, Yang Ling
Wei.
Ling. Which vessels paired points are specifically indicated for treating excessive vaginal discharge when combined with acne on the chin? So this is dumpy heat in the blood.
Ren.
Renman.
Ren, kasi, yeah.
Okay. Maraming ganyan. Actually, dapat, yeah.
Ren.
So pag may nakita kang acne on the chin, you might as well ask, do you have excess vaginal discharge? The same pulse quality in multiple positions reflects flooding of which structures into the extraordinary vessels?
The main.
Main channels. Which point is the starting point for Tumai?
Duan.
Duan, kasi meron siyang mga points. Which vessel is described as the most meandering because it traverses many main channels?
Yang Chow.
Yang Chow Mai. Which ancient text first explicitly recommends the opening point first, followed by the couple point sequence for the Chong Mai?
Number 1.
Gatherings. Diba?
Yeah,
Di ba yung ganyan ko muna?
great content view. And the last one, using both points of an extraordinary vessel transcends the action of the individual points. See, transcends the action of the individual points. This is primarily due to what?
Number 1.
Yeah. Ina-activate mo yung chi reservoir function ng vessel. Yung mga inipo niya na energy. Wow! Congratulations everyone, you did well. Let's go to the next one.